Apparently, there is no need in foreign labor in Kazakhstan. The immigration agency has cut in half the quota for attracting foreign workforces due to the economic crisis. This was stated by the Ministry of Labor and Social Security on Friday, June 18th. Illegal migration is quite a problem, which is also difficult to control, while Kazakhstan has become a receiving party in the regional migration process. The inflow of uncontrollable workforce mainly comes from the CIS member states, with which Kazakhstan has no visa restrictions, said Labor Minister Gulshara Abdukalikova. Many illegal workers come over and occupy jobs not popular among the local population. At the moment, the number of internal migrants have stabilized to about 300,000 people, a major part of which are rural areas residents. The analysis shows that they perform quite a low level of adjustment potential, moving chaotically. We are well aware that migration is not always a creative force. Regarding the migration from other countries, especially neighboring Kyrgyzstan, the authorities say no drastic changes of the current condition are expected. Moreover, the situation in Kyrgyzstan seems to be stabilizing and is more or less under control. Thus, there is no need to worry about the inflow of refugees.
Kazakhstan is not expecting an inflow of refugees from Kyrgyzstan. The authorities assure that there is no need to worry about the illegal immigrants. The Vice Interior Minister Alexander Kulinich is confident that the situation in the neighboring country is gradually stabilizing, and therefore there is no need to close the borders, although the security is tightened nonetheless. So far, we do not see any reason for mass inflow of refugees. Not a single refugee from Kyrgyzstan has officially been registered in Kazakhstan. The Labor and Social Security Minister admits they received some phone calls from Kyrgyzstan asking for help, but the ministry's assistance was limited to phone consultations only. We have given consultations and fully instructed all who appealed to us through the phone on what are the required procedures for entering Kazakhstan as a refugee, although we have not seen one yet. Right now, there are many ethnic Uzbeks seeking refuge are crowding the borderline of Kyrgyzstan and Uzbekistan. Meanwhile, Kazakh officials are discussing the migration issue in general without a focus on problems in the neighboring state. Officials like to declare that Kazakhstan takes great care of the refugees. As a responsible member of the global community, Kazakhstan takes an active part in solving the problems of refugees. As you know, last year we adopted a law which regulates the process of granting the status of a refugee, the number of which has reached more than 600 persons in Kazakhstan. The authorities like to ignore events in Kyrgyzstan when it comes to official statements and speak about it only in the halls. They are certain that Kazakhstan should not allow the mass refugee inflow onto its territory. Regarding the migration policy, I believe we have to filter it thoroughly before we let anybody onto our territory. This is required because the world practice shows that when refugees enter a country, they are not likely to leave anytime soon. High-ranking officials are confident that the mass inflow of refugees from Kyrgyzstan is not likely to happen. Perhaps this opinion is due to the understanding that the conflict is in the south of the Kyrgyzstan and the risk of refugee inflow is higher for Uzbekistan rather than Kazakhstan.
An emergency in northern Kazakhstan. The village Novodolinka in the Akmala region has been quarantined by the law enforcement agents as local residents are not allowed to leave their households due to the outbreak of the foot-and-mouth disease. Some 2,000 cattle will be killed in the area. The Agriculture Ministry investigates the case and looks into all possible causes, including the intentional spreading of the virus.
Agriculture specialists assure that all infected animals, along with cattle which were kept together, will be slaughtered and farmers paid compensations. More than $160,000 were allocated from the budget for these purposes. Experts also say that the virus is able to spread out quickly through the air. Currently, vaccination campaigns are held in all settlements within the 50 kilometers area from the center of the foot-and-mouth disease outbreak. More than 200,000 vaccines have been supplied to the site. The export of meat from the Akmoli region is fully prohibited for now. We set up a mobilized group made up of 6 brigades who will conduct vaccinations and disinfections and also confiscate and get rid of sick animals as well as launch entrance and exit checkpoints in the settlement.
Kazakhstan is celebrating the Medical Workers' Day. In spite of the authorities' optimistic reports on the national health care, it remains indeed in the emergency condition. The lack of finances and human resources considered to be the major problem in the field. Some provincial hospitals do not even have basic equipment and medicaments, while patients are offered to buy it from the staff or bring over from elsewhere.
The family medical dispensary in the city of Semey serves nearly 10,000 people. Unfortunately, there is nearly not enough equipment for this number, as doctors still use the old and outdated tools from the Soviet era. The diagnostic center also requires major maintenance, as the last time the building was renovated 15 years ago. We want to buy new equipment for the physiological therapy room, and we also need to re-equip all the laboratories. The situation in Almaty is not any better in all the medical care institutions, including pediatric, cardiology, physiatric and other centers. All of them experience the lack of finances as well as professional staff. Unfortunately, there is a 55% shortage of staff in the dispensary, 25 in children's care and almost 70 in the emergency ambulance service. Again, the big issue here is the financing and low rates of salaries, which lead to the shortage of human resources. The most qualified medical workers are paid between $300 and $400 a month. It seems if the healthcare ministry officials don't realize how important the well-being of doctors is, the very people responsible for the lives of hundreds of patients. Anara Sadikova doesn't trust Kazakh medical institutions. While spending 9 months in the pediatric hospital with her 2-year-old son, she has experienced total indifference and negligence of the local personnel. The woman claims that most of the time patients helped each other. Right now, Anara is undergoing treatment in China. Maybe nurses are paid a little, I don't know, but when I was in a hospital, only 2 nurses worked night shifts, so that we, patients, would do a lot on our own, helping each other get shots, etc. Despite the crisis and the decrease of funding, we were able to allocate about $18 million for the healthcare, which is $1 million more compared to the last year. The healthcare share of the total GDP spent in Kazakhstan every year is 4 times less than in Europe. In general, Kazakhstan has the potentials to provide high-quality medical services to population in compliance with international standards. Usually, it is due to the powerful base left as a legacy of the Soviet Union. Quite obvious this may all fall apart if nothing will be invested in technical and human resources, as well as pharmacy and science.
6 medical workers of southern Kazakhstan are serving prison terms convicted of infecting children with HIV. Sentences to 4 more were deferred due to them having to take care of small children. Now the regional authorities are suing an emergency doctor and specialist of a district ambulatory clinic, charging them for the outbreak of the hemorrhagic fever.
Dr. Aliyev's works on saving people's lives under severe pressure as the young resuscitator is charged with professional negligence and may face up to 5 years in jail. In summer of the last year, a patient brought to the infectious disease hospital of southern Kazakhstan was diagnosed with enteric fever. When he died a day later, doctors found he actually suffered from a Crimean hemorrhagic fever. Now the young specialist says the diagnostics is not the prerogative of emergency doctors. This is a very tricky situation that not only me, but most of my colleagues are disappointed. We're in a poor spirit and I don't know what to do. Maybe I will have to quit my job. Looking at my case, many lost hope for justice. This is not the first incident of this kind in southern Kazakhstan. 4 years ago, there was a scandalous case when 150 babies were infected with HIV. Then 6 medical workers were convicted and 4 were reprieved as they had young children.
Если это действительно вина врача доказана, конечно же, тут разговор нет. Можно только
When doctor's guilt is proven, there's nothing left to do but to ask for a softer sentence. But sometimes nothing is proven and it affects the entire system. Often people responsible for tragedies who should have supplied appropriate finances or taken necessary decisions avoid punishments.
Все эти дяди сидят, принимают решения, но все это не доходит или принимают слишком поздно.
3 medical workers are charged for the current breakout case. 2 of them were cleared from charges and only one still remains under the investigation. Professionals say it is not safe to be a doctor now, as no one protects their rights. At the same time, the region's hospitals experience the shortage of human resources by about 50%. In the meantime, the regional infectious hospital is holding a celebration ceremony honoring the most promising doctors. The suspect, Eldar Aliyev, was amongst the distinguished people who received recognition diplomas.
Have a great weekend. Goodbye.